Hi, this is Jenny, and I am going to show you how to apply first aid after an exposure incident. What you need to do first is you need to stop working on the patient immediately. Remove your gloves from the inside out. You're going to wash your hands thoroughly, but make sure when you are washing your hands, you turn the spigot on with a towel. You scrub your hands in between fingers, up your arm, a little bit more soap, rinse, shut the water off, dry your hands completely, you're going to apply an antiseptic to the wound area. And apply an adhesive bandage over the area. When you are done, you're going to fill out an incident report and make sure you tell the dentist or your employer. The next thing I'm going to be doing is I did show you how to wash your hands before gloving. So we're going to skip that step and we're going to go to how you use an alcohol-based hand soap, which is called just like a hand sanitizer. You just squeeze it onto your hand in a pea-sized amount, rub it in between your fingers on the top of your hands, until it is dry. The next thing we're going to do is put on the protective wear that you need to wear when you're working on a patient. You need to put on protective clothing, a mask, protective eyewear, and gloves. And before you would glove, you would need to wash your hands all over again. But since I did all them steps, I'm just going to put my gloves on. And now you're ready to work on a patient. The next thing we're going to be doing is I'm going to be showing you how to put on a protective barrier. You need to wear all your protective attire. Plus, you need to have on utility gloves for when you are removing it if it is contaminated, which you always got to make sure you pretend things are contaminated. You never want to take into your hands that they're not. So when you are putting on a protective barrier, you need to decide what size is best for what you are covering, what areas you are going to be covering, and make sure it covers all the contact areas that a patient or you yourself or the dentist will be touching. When the patient is done, you need to put on your utility gloves and remove the surface barrier from the bottom up, trying to roll it inside out in case there is any contamination on it. You then discard it in your normal waste. The next thing we will be doing is performing treatment room cleaning. You need to wear all your same protective wear and utility gloves so it doesn't go through the other gloves, because some materials eat through normal latex or examine room gloves. You can either use a spray disinfectant or a wipe disinfectant, depending on what the treatment was that you were cleaning up. You just need to make sure you clean every area that could possibly have gotten contaminated. The next thing we will be doing is autoclaving. In the autoclave, you need to make sure your utensils, your instruments, are dipped in the solvent, put into the proper bags, labeled, closed tightly, put into the autoclave for the right amount of time and temperature. When they are done, you need to use hot pads because they're going to be very hot. If I can find them. You need to take them out, open the bag very carefully, put the instruments on the tray, and they will be ready for the next patient. The next thing will be sterilizing instruments with chemical equipment. You need to wear all the proper clothing. You need to have a sterilizing solution. Sit down, please. Tongs to get the instruments out. And you will be putting them into the sterilization water. Do not put your hands in. And then rinsing it in a sterile solution and letting it lay to dry. When you are done, you need to make sure you wash your hands completely, that you do not have any of the chemicals on it, because you could end up getting a chemical reaction to the materials that are used. Sterilizing the dental handpiece is, again, using my son's sippy cup. It's in the bag. You need to take it out, wipe any visible debris. You need to remove the burr from the handpiece. You can either use an ultrasonic cleaner, you can use a sterilization like this, or simply, if you need to, you can use a liquid sterilization. Wipe it off. When you are done, you might need to lubricate the end going into the mouthpiece if it doesn't fit in right. You don't want to jam it in. You want to work it in nice and easy. When you are done, you will wipe the tip off with the alcohol and cotton swab. Then you will repackage it. You will put it in a package ready for the next patient. That is the end of my procedure. Thank you.